Hey guys, Dan the Angry Physio here, and I'm going to make a prediction about you. You've got one leg that's good and strong and that you can rely upon, and you've got one leg that's crap. And what do I mean by crap? I mean like it's weaker, there's less muscle bulk, it becomes upset, or you can have pain often too easily on this leg, and problems can persist. Let's take a look today at how you can identify this and what you can do about it. And I'm going to show you one thing that you can do about it that is long term, is super easy to do. It doesn't require any equipment. It just requires your ability to want to do it. So without further ado, let's take a look. So what do I mean by me saying that you have one leg that's crap? Well, let's take a look at this photo right here. Now you can see right here that this individual's left leg definitely looks a bit deficient if you look at it closely. There's less muscle bulk, it's a bit smaller, so observation is a pretty easy way to corroborate maybe what you're thinking. And most people will kind of know when they have one leg that kind of isn't up to snuff. And what other signs can we see here? Well, one thing that I tend to see is that you will see very often that people will tend to cross a weaker or a crappy leg over the stronger leg when they're sitting. And I see that all the time with patients. What else do I see? People also tend to lean away from their crappy side when they're standing and default over to their stronger leg. And that kind of perpetuates the cycle of facilitating a stronger leg and kind of neglecting a weaker leg. Let's get a little bit more complicated than this. Another way that you can tell if you're not really sure if you have a crap leg and you want to do a couple tests, how about you lie down and you do a single leg bridge like what we have here in this photo. With the single leg bridge, when you bridge up and support the weight through your stronger leg, your pelvis is usually going to look a bit more stable than when you try it with the other side. When you try to lift yourself up with your crappy leg, very often the pelvis dips a little bit, as you can see right here from this photo. And another test that I use clinically with patients, which I think needs to be studied more, but I find it to be a kind of a quick and dirty way to assess whether someone has a crap leg, is to have them sit on a high-low table. You can see from the video here, I'm speeding it up a little bit. Sit at a high-low table or sit on a chair. And then, without thinking about it, get up using only one leg. And guess what, people? I never see people stand up using their crap leg as the sole support. It always is the stronger leg. So guys, what about the etiology of this? Like, why does this happen? So there are many possible answers for this, and I think maybe it's a confluence of things, several things happening together, which kind of over time leads to this one leg kind of being weaker and crappier than the other leg. Side dominance, I think, is one of these many factors that can have a contribution to this. Remember that we have hand dominance, and just as we have hand dominance, we have leg dominance. Now, the leg dominance is not really as operationally defined as is hand dominance, but it does exist. And I love this quote. I'm going to put it on the screen. Unilateral dominance is a form of asymmetry where one side is more proficient than the other. And that comes from a book called The Left-Hander Syndrome that was written a while back. I think that quote definitely applies to this situation. So having one-sided dominance can definitely have a bearing upon your strength in the long term. What else can affect it? Well, your past medical history can affect it. What happened to you in the past? Did you fall and sprain your ankle or fracture your ankle 15 years ago? Well, that's going to have an effect on how well you put weight through that leg. And maybe during the recovery process, if you had an injury, you were disfavoring that side. And maybe if you did that long enough, that's going to kind of have a repetitive long-term effect on how you use your body. So things like that can definitely also contribute. What else? Environmental influences. So aside from injuries, which are environmental influence, also just regular environmental influences such as, let's say, sports that you pick up. Perhaps you learned how to play a sport a certain way and use one leg over the other because that's what you were taught. maybe driving a car. That's always another thing that I kind of default back to. You're using your right leg a lot to operate the gas pedal and the brake, and not your left leg. So that's just one habit that you've learned, which has a predisposition to use one side. So maybe all these things over time have a cumulative effect and have kind of led us to where we are in terms of our leg strength. So the burning question here is, what can you do about it? And to take a very simplistic approach to start, you can exercise and strengthen a crappy leg or a weaker leg, and you can get it stronger. I do that all the time with patients, and you can do it too. It's a simple concept that makes sense. You increase the strength through resistance training, and you come at the other end with a leg that's stronger. But I tend to think a lot of the times that's not enough. And what do I mean by that? Well, if you're used to defaulting over to your right side, we'll say, for example, and you strengthen your left leg up, if you don't reinforce the strength gains that you've made on your left side functionally or practically with everyday stuff that you do, there's a very good chance that over time that left leg is just going to kind of peter down again, just because your neurons long term are still used to using that other side. So you have to practice, and you have to do meaningful practice in terms of trying to get yourself more symmetrical. What I'm going to show you now is one activity that I have been using with patients for years that is super simple, and it is a way to kind of reinforce the gains that you make on a weak side. Now, the most simple explanation of it is I tell patients to count their heel strikes on their crap leg. And you're probably thinking, like, what does that even mean? All I'm saying is that when you're walking, take an arbitrary distance that you're walking. Let's say one city block or 50 paces, and just go out there and practice every time your left heel hits the ground. Mentally count it. So you're going to count up to, let's say, 50 with 50 left steps as your left heel strikes the ground. Now, I don't cue anybody or coach them to do anything more than just that. Don't even worry about what muscles are contracting. You know, when your left heel hits the ground, that's the beginning of the cycle of when your glute max kicks in to kind of pull you forward, because that glute max needs a closed chain. It needs a heel on the ground to kind of pull. So that's true, but I wouldn't even obsess about trying to overthink it and hence maybe change the way that you're walking. Don't even worry about that. Just count your left heel steps 20 times, 30 times, 50 times. Try it daily. It will just help you to kind of reinforce the neural pathways. And remember, this is to be used as an adjunct to the strength training of a crappy leg. Now, are there any disclaimers here? If your left leg is so horribly weak and crappy, you should really work on building the strength first, because doing the heel counting when you're walking might actually overwhelm it. So like I said, it's an adjunct to strength training. Keep that in mind. I also think some people are what I refer to clinically as motor morons, meaning that it's very difficult for a significant but small percentage of the population to coordinate motions and to think about something and move at the same time. Doesn't mean you're stupid. I know tons of genius level people who are motor morons. It's just one manifestation of a certain trait in our physiology. But if you find that you are a clumsy person, maybe talk to your doctor first about this, and let's make sure that we're all on the same page and that you're okay to do something like this. And as a little final anecdote here as to why I recommend doing this, I had a patient in the clinic last year whose left leg was very weak. She checked all the boxes that we talked about in the earlier part of this episode here. And I put her on the treadmill and just asked her to count her left heel strikes for 3 minutes at the end of one of our sessions. And I stepped out of the room for a minute, and I came back in, and she had stopped after about a minute and a half. And I asked her, I said, "Are you okay? Is everything cool?" She's like, "No." She said, "I could only do it for a minute because my left leg got so tired that I had to stop." So that's one person. That's a one person case study. So take that any way you want it, but it has the potential to be very effective. And one last note is, when you do this type of re-educative activity, get a good night's sleep that night, because That's really when those neural pathways really kind of help and develop and become more situated. So get a good night's sleep on the day that you train your leg and the day that you kind of work on the potentiation of those neurons long term. Feel free to drop us a comment. I'm Dan, the Angry Physio. Thank you for watching. Subscribe, rate, review, all that fun stuff, and we'll see you next time.